You going to start?
Okay. Hi, everyone, and welcome to Amazing Individuals, the show where we break down barriers and celebrate the limitless potential of people with intellectual disabilities by sharing their stories of resilience, achievement, and the power of believing in yourself. Because when we focus on abilities instead of limitations, anything is possible. We're your hosts, Lisa and Kurt Noble, and we're and if you're whether you're tuning in to in your commute, at the gym, or just kicking back at home, we're glad to have you here. Today we're excited to welcome Taylor Combs, who is the Health and Wellness Director for Special Olympics Illinois. So get ready to be inspired because this is Amazing Individuals, and it starts now.
Taylor, it's a pleasure to have you on Amazing Individuals. To start, could you share a bit about what inspired you to get involved with Special Olympics?
Hey, Kurt and Lisa, thanks for having me. What inspired me to get involved with this organization is, well, my background in public health and event planning and recreational therapy, and a little bit of social work gave me the professional foundation skills for this role that I'm in. But what truly inspired me to go in this direction, to work with this population, was my personal experience growing up with a younger brother. His name's Austin. He has an intellectual disability. He has Kleefstra syndrome, which is very rare, but is characterized by intellectual disability. So growing up with a younger brother, with that experience, taught me early on about the challenges that people with disabilities face, and it shaped my understanding of importance of inclusion, equity, and belonging, because we all wanted a place to belong, to be seen as equal. So combining my love for health and sports, because growing up I played sports, Special Olympics felt like a really good place for me to channel both of my passion and purpose. So when I saw this job posting, maybe 3 years ago, I just went for it.
That's great. Sure, girl.
As a part of your job, you host different events and training like the one that Lisa, myself, and a couple others athletes did last week. Could you tell our listeners a little bit about that event and how it came about?
Yeah, of course. So last week we partnered with SAIL UIC, which stands for Simulation and Integration Learning Program at the University of Illinois Chicago, to essentially pilot a health simulation designed specifically for our athletes. The goal was to strengthen our athletes' self-advocacy and communication skills, especially when preparing for a doctor's appointment or talking with healthcare providers. So during this training, we walk through practical scenarios, like how to prep for a doctor's appointment that works best for you. Do you write notes, or do you want to bring your medication with you? What to bring, and how to clearly describe your symptoms, especially if this appointment is not just your annual routine checkup. We also discussed prepped and discussed ways to speak up if you have concerns or questions about your treatment plan, how the doctor wants to treat your symptoms. So beyond the simulation, this pilot program, we were looking also to explore how we could better support our athletes with tools and resources and any sort of information, so to help them navigate the healthcare system more with confidence and independently as possible. Because policies at hospitals and our insurance plans are always changing. So it's really important to know what questions to ask for the sake of your health.
What was one of your favorite parts that you enjoyed about last week?
Um, I think what that is answering the questions
Hmm.
and what people were talking about and really expressing myself.
So like when we were kind of debriefing after the scenario, kind of like talking about how you're feeling, how everybody else is feeling, and what we learned from the process. If there was a time to like advocate for yourself, if and you didn't, why didn't you? Or you did advocate for yourself. How empowering did that feel? Is that
Yeah.
what you're talking the debrief? Yeah, I like that part too.
Yeah.
You know, answering their questions, but not going overboard. And, and so that's what really inspired me to answer their questions.
Yeah,
Well,
it was great to hear your perspective too.
yeah, well,
Yeah.
and what I liked
Right.
is that, it gave us a chance to like, kind of, like you said, kind of advocate for ourselves, like, if, like when they were, simulating, like saying they were going to prescribe a medicine and that we weren't, comfortable with that. It kind of gave us a chance to kind of more comfortable of saying, wait a minute, I have a concern, or, instead of just going with it. What I also liked is that with you at least was that usually, which isn't our problem, but sometimes, he'll have an issue like when, somebody will ask him a medical thing or whatever, he kind of doesn't know the answer or something. But if he gets prepared, that it kind of gave you a chance to be by yourself with some and to know that you can advocate for yourself too.
That one person I had, we did a one-on-one, but it was just me and him, and that was it. And that, and I told him what my disability was, and then it was just a one-on-one with me. But, it felt really good at getting that out.
Yeah, it was a chance for you to explain what your disability is, what you
Yeah.
need to,
But
what help to help you understand medical terminology, what kind of concerns you may have, how do you explain that
yeah,
in a way that he can help you understand how he wants to move forward, how the doctor wants to move forward.
Right.
And when, like you said, Lisa, when the doctors give you a treatment plan, sometimes, we say, okay, that's what it is, because the doctors are especially we want to trust them, but sometimes it's good to ask questions to understand because we know our bodies. If the doctor says, for example, this this medication is known to give you a side effect of nauseous, and you're like, I really don't like that feeling. Could we explore other options? It's okay to see what else is out there. And like if like Kurt, I think your diagnosis with the pre-diabetic, like the doctor prescribed you the treatment plan of okay, let's implement exercise, let's change your diet.
Right.
Are you able to realistically handle those? What will help you implement those changes into your current routine with work and sports and everything else going on in your life? We have to kind of think, is this realistic for me? If we take medication and they want to give us a medication morning, midday, and night.
Yeah.
Just my schedule allows. I mean, what can I do if I'm okay with taking this medication? What can I do to make sure I remember the 12 o'clock pill? Because I know I personally would forget.
Yeah.
It'd be like 3 o'clock. I'm like, shoot, I forgot my medicine again. And that's gonna help. That could be hard for your body to adjust this new medication because you're not taking it consistently. So it's important to ask those questions because you want to make sure the treatment plan works best for you as well.
But it's sort of like with like, well, what are your medications? Well, they're all on the on the chart or the on the what is that thing called?
Is that like the visit summary?
After visit someone, is that what you're talking?
No, everything's in the computer.
Oh,
So like if
Oh,
you
yeah.
need to look for all my medications are on the computer. That's it.
Yeah, you can.
So that way, so like they would they ask me what are you what are your medications? I don't know because
Right.
you have to
You
look.
have that source to
That's
say this is my medication because it's hard to, especially if we take
I
more
got a
than
lot
one
of-
medication daily. It's hard to keep track of all the medications.
I take
So it's really nice, and that's why it's really recommended to bring a list of all your medications or bring it all so that way the doctor is also aware of all the medications you take and make sure there's no concern with overlapping these medications as well.
yeah.
So we talked about like the importance of highlighting like this is everything I take, this is the supplements I take, the vitamins I take, get them a good brief of what your routine looks like.
mhm,
Yeah.
exactly. So,
Mhm.
So another program besides the one we did last week that you help out with is the Healthy Athletes. Could you kind of go into a little bit of what that program is?
Yeah, of course. So Healthy Athlete is one of our main health initiatives. It's focused on making sure our athletes' health remains a priority with everything else we have to offer within our organization and help them feel good when they're on and off the playing field. So through the Healthy Athletes program, we provide free health screenings in 8 different disciplines. So we have health promotions, which is prevention, and nutrition, more education. Opening eyes, which is vision. Healthy hearing, where we have audiologists come out. Fun fitness, physical therapy. Special smile, which is dentistry. Fit feet, podiatry. MedFest, which is sports physicals, and then Strong Mind, which is a mental health program. So these screenings we are usually offered in conjunction or in paired up with another sporting event, and we do our best to make them accessible to all of our athletes across the state. To host these events, we partner with local healthcare providers and medical students to generously volunteer their time to do these screenings. They also will take time to provide and share helpful health information and connect athletes with follow-up care and resources if needed. Um, Healthy Athletes isn't just about, early detection. It's really about, empowering our athletes, promoting long-term wellness, and also building a better trust between the healthcare system and our athletes.
And that just goes into my next question. Why is Healthy Athletes in the event, that we did last week, so important to individuals or athletes like, Kurt and myself in Special Olympics?
Yeah, that's a great question. These programs are really important for our organization and our athletes because they address a critical gap in our healthcare access and understanding for individuals with intellectual disabilities. Many of our athletes face barriers such as lack of provider training, communication challenges, finances, insurance limitations. Like if you have Medicaid, only so many doctors in your local area take Medicaid, and they become over stimulated with having too many Medicaid patients, and they can't take anymore. Transportation, or simply being overlooked, undervalued, and that affects their ability to receive quality health care. So through our Healthy Athletes and Health Education program, we provide free and potentially, life-changing health screenings, but it gives them a chance to be educated on how to take care of their own health, ask questions, advocate for themselves. For example, our Special Smiles program, we demonstrate using puppets and these large toothbrushes to demonstrate how to properly brush your teeth using the circle motion and how to properly floss. So athletes are learning how to floss and brush the teeth properly. But they also get to take home a goodie bag, which includes floss, toothpaste, and toothbrush. So they get to take home what they learn and hopefully implement it in their daily routine. Everybody deserves equal opportunity to equal quality health care. So whether that's through our screening or education or resources that we can provide, we're going to do our best.
I know that.
Also,
Yeah, I
go
know,
ahead.
Taylor, that I know that when I've heard stories like you have too, like, but when we've gone to, like, when we went to the USA Games in Florida, and even when in Germany, that there's been times where, there was like an athlete that, for the longest time couldn't hear his coach because he didn't have access to the right audiologist or whatever to give him a hearing aid, and then all of a sudden they gave him a hearing aid and he was able to hear everybody. He was able to hear his coach and stuff. So, and then, so yeah, but you hear stories like that, and which is nice. It's sad that they have to wait that long, but it's nice that they have a program out there that they can reach out to like that. So
Yeah, and yeah, while like our healthy hearing program, we don't provide hearing aids, but they can provide like cleanings and maintenance work. So that's a nice little add-on for our healthy hearing program. But they also provide local places that these athletes can go to if they do need hearing aid. So we do our best in that. And I got Opening Eyes program has been really beneficial for our athletes. If they have any change in their prescription, they do give free glasses. It does take some time to receive them because we do ship them to a lab out of the state. But eventually they do get the glasses and they're able to see more confidently wherever they're at work, school, or playing sports. So it's really empowering to hear the stories that our health screenings have such a positive impact on our athletes, and our healthcare volunteers really enjoy the working with our athletes. Because this program really just gives our athletes and healthcare providers, medical students, the chance to build relationships, because when we work together, we're taking steps towards a more inclusive, understanding healthcare system.
Yeah, I know for a fact that there used to be a doctor that did our healthy athletes. Her name was Sandra Block, and I've gotten to know her really well. And she's asked me a couple times to go on calls or to do, to kind of help her discuss about, the advocating for people with disabilities in the healthcare industry. So, that's kind of helped too. So, so go ahead, Chris. Okay.
Are there any challenges you face when you are trying to promote health and wellness?
Do you mean by like general health or like our health initiatives?
Probably both.
Okay. It's a good question, because one of our biggest challenges with recruiting with our health program, especially Healthy Athlete, is recruiting enough healthcare providers to host and support our health screenings. Our clinical directors, by clinical directors, these are the medical professionals that lead each discipline where we host an event. We're super grateful for them. But as we look to expand these events throughout the state into newer areas, finding enough providers to make that happen is tough. For example, like our largest Healthy Athlete event takes place during our summer games, where we offer 4 disciplines. However, not every athlete attends to summer games, so we're trying to expand, because it's important for us to bring these services to more local communities. If you know a doctor, nurse, EMT, chiropractor, a podiatrist, dental hygienist, anyone in the healthcare field that would love to be a part of our event, we would love to connect. So that is on the health side. I would say, as far as the health and wellness, I think this goes for anybody. As far as like wellness goes, athletes may not have the proper support to utilize our resources that we provide the website or use in our sporting events. Sometimes we don't have enough staff to bring healthy habits to our sporting events, to provide these education at their local events. It's hard for us to be in all regions at once. And along with that, we're just not able to expand as quickly as we like. So not every sporting event will see us. Some sporting events might see us more often just because of logistics and environmental logistics placement. And I think this one goes for everybody. Not everybody's motivated to work out. I know for me, I love going to the gym, but sometimes I just get in that funk. I just need that extra motivation. Sometimes we just need that extra push by family and friends. We try to address some of these challenges through our Healthy Athletes program by offering them as much as we can, along with healthy habits. We offer, fitness and nutrition education on our website. It's also on the Special Olympics North America and international web pages, so they're accessible anytime. We try to make sure our athletes are aware of that. So we do our best to make sure that we promote our fitness education and Healthy Athlete program as best we can.
That's good. Sorry. Good.
Another part of your job is training athletes to become health messengers. Could you please talk about that a little bit and explain why having athletes as health messengers are needed?
That's a great question. I hope messenger training is honestly one of my favorite parts of the job, and I'll explain why. Before I'll go into what this is. Help messenger program are athlete leaders who go through training to become advocates and role models in health and wellness. They not only learn how to make healthier choices for themselves, but they use their voices to encourage their teammates, families, and coaches to do the same. These athletes are really are powerful advocates for health equity, especially when they share their own experiences and the barriers and discrimination they may have faced in the healthcare system. So their stories, bring real human perspective to that conversation about why inclusive healthcare is so important. So before these health messengers become certified, they are to complete a personal project, something health related, something that they lead from start to finish. It could be running a health education station, posting wellness tips on their social media pages, leading a team warm up, anything that really helps and promotes healthy habits or healthier habits. And this is my favorite part of my job because it's really inspiring them to see them take ownership of their health messenger role, showcase what they learned in their training, build confidence in their skills and their knowledge of what they learned in training, and realize the impact they can make, not just in Special Olympics, but like in their own community as well. And this program and our health messenger leaders are incredibly valuable to our health program because they not only promote what we do and spread the word, but they help our athletes more than because I can't connect with everybody. They help me connect with others. So they're really beneficial and valuable.
Yeah, and I think, like you said, I think coming from an athlete kind of helps a little bit because it's like it's coming from your peer, it's not coming from a staff member, so it's so you have that relationship better. So yeah. What are a couple of your future goals that you have for the Special Olympics health program?
That's a good question. I have a super long list. I'll keep it short though. One of my biggest goals is to expand our healthy athlete events so that we're reaching every region of Illinois, not just larger competitions. And as far as that health messenger program grows the next year, I would love to see more health messengers take on health related roles in the communities, whether that's leading, health education stations, speaking at events, or sharing resources. This would help us provide more health resources throughout the state. Being a small health team, it would really help us, expand, make sure that athletes in region F and K and J and A and D are all getting the same resources because we promote equality in healthcare. And hopefully we can also provide local resources for them as well. Another big goal that I have is to grow our fitness program so that way our athletes have more year-round opportunities to stay active and engaged. We have an app that we use that just came out. It's really cool. It's easy to track your nutrition, physical activity, and hydration intake. So something to explore there. But we also have like an online virtual workout sessions that we host every other month. And we also have a lot of Fit5 at-home workouts that we provide at web pages.
No, that's good. So, again, what training and resources do you provide coaches, to help support and train athletes like ourselves?
Yeah, so through our coaches training, we do our best to provide resources that are specific to the sport that they're coaching, just making sure that they're well equipped to train and support the athletes. We plan to, within next year, to really expand our efforts and offering, including additional resources such as the Fit5 program, the Fitness Through Sport, which promotes holistic athlete wellness through fitness, nutrition, and hydration. Currently, these programs can be found online, but we are hoping to include that in the curriculum at the coaches' education. So not only are they teaching them proper form, but they're talking about supporting them, nutrition and hydration while they're training, while they're competing, all those things.
That's good. Mhm.
When you're not working, what are a couple of things you like to do for fun?
When I'm not working, I love to spend time with my dog, Jilly. She keeps me on my toes. I love to spend time with loved ones, friends and family. I enjoy CrossFit, so I go about 3 times a week being outdoors. So I love, this time of the year and fall, just being outdoors. But I also love a cozy night and watching movies or playing cards.
Oh, that's good. Yeah, yeah, we usually watch YouTube stuff, right?
Yeah.
Stuff on YouTube, so.
Can't go wrong with that.
Yep,
Yeah.
can't go. What is one thing?
What is one thing people may not know about you?
That's a good question. One thing that people may not know about me is when I was diagnosed with type 1 diabetes right before I turned 70, so like 7, not there yet, which was like 24 years ago. After my diagnosis, my mom found a local diabetes camp for me to attend. I ended up loving it, and I returned as a camper for 11 years, and then returned as a staff member for another 4 or 5 years. Diabetes camp, everybody's like, what is that? Your typical camping experience, kayaking, swimming in the lake, bonfires, sleeping in the cabin, camp songs. But it also included, wellness, education, diabetes management, which made it really unique. However, while I don't attend a camp anymore, I still am in contact, in touch with a lot of my camp friends through Facebook and all that. I'm actually going to visit one of my camp friends in Colorado in a couple of months. So this camp has been really meaningful to me in a lot of ways.
Well, that's good. That sounds like a fun trip coming up, so.
Yes, definitely.
Yeah, well, Taylor, thank you so much for joining us today. Kurt and I are happy to have you be part of the Special Olympics Illinois family and to have you help promote health and wellness for athletes like ourselves. Before we let you go, can you let our listeners know how they can get involved in Special Olympics in their communities if they want to be involved?
Yeah, the easiest way to check out that website and just look for upcoming volunteering sites, opportunities, whether they're sport or health. If you are in the healthcare field and you want to learn more about health education and our healthy athletes, feel free to reach out to me, email me. I'm happy to share any sort of information you want to learn. We'd love to learn how you want to get involved. Those are the 2 best ways to get involved and to learn more about our program. So.
Are you on Facebook?
Yeah.
Am I on Facebook? Our health and wellness program is not on Facebook.
No,
Oh,
no,
okay.
that's not on Facebook. Okay, thank you, Taylor, so much. So, before we end, we want to express our gratitude to our anonymous sponsor. Their support helps us continue to share these inspiring stories and advocate for individuals with intellectual disabilities.
Lisa and I look forward to bringing you more great episodes, and remember that people with intellectual disabilities can accomplish whatever they want with the right support. We'll see you at the next on amazing individuals.